Hi, my name is Lindsay Black. I'm the Director of Marketing here at Fairview Park Hospital. And this month we are celebrating OT Month. And so we want to come to you today to introduce you to some of our OTs. And they're going to tell you a little bit about what they do on a day-to-day basis, what it takes to become an OT, and all the great services they provide. So I have here with me today.
My name is Terrance. I've been an OT here at Fairview Park for about 4 years now. To become an OT, the typical schooling is approximately 6.5 years, which includes on-site field work, and it also includes classwork. So once you complete your 6 years, you take boards, and you are able to practice.
Wow, so 6 years. Now, what school did you go to?
I went to OT school in Alabama to Tuskegee University.
Great school.
Thank you.
Great school. Now, I have also with me here today Miss Stacey Davis. Stacey, tell us about yourself.
Okay, I'm Stacey Davis. I've been an occupational therapist for 33 years. I've been at Fairview Park as the director of all the therapy services here for 18 years. I went to school at Medical College of Georgia in Augusta, now known as Augusta University. That was back when. So, would like to tell you a little bit about what we do in a day's time. As OTs, we come in and we treat kids, we treat older people, we treat in between, and we assess what issues and difficulties they may have being able to live a functional life and being able to do things for themselves. And when I say those things for themselves, it's anything you and I get up and do in a day's time. It's bathing, it's dressing, it's feeding ourselves, it's getting off and on the toilet, it's doing all those things in an independent way. So whatever their issues or difficulties are, we work with those things. If they've got strength problems, we work with strength. If they need equipment, adaptive equipment, we work with those people to help them learn how to use that adaptive equipment to be able to do things for themselves. So we're all about getting people back to an independent living of life and helping them to regain their function to do their daily tasks each and every day. Here at Fairview, we treat from pediatrics to geriatrics, and the services, some additional services we offer. We offer some lymphedema services. We offer vestibular services. So if someone has issues with balance or dizziness, we have a program for that. We treat upper extremity difficulties with shoulder pain, hand injuries, wrist injuries, and what those issues cause people to be able to not to do in their everyday life. Then we work and we help them learn to either do things in a modified way, or we teach them how to become more independent. So that's what we do as OTs here at Fairview Park.
That's great. Well, I know that there's a little bit of a difference here. So there's the outpatient setting and then there's the hospital setting. So can you kind of explain that a little bit? Like, how does the services differ between the short hospital stay and then being out here at the therapy center?
The services vary between the hospital and the outpatient. So if you're in the hospital setting, a typical OT treatment may consist of bathing, dressing, eating, helping a person regain those skills that they've lost due to weakness or a disability. And in the outpatient setting, it's a more intense therapy, so the patients are typically seen for an hour, and that's when they can work on those skills and kind of get them better. So we work on the strengthening, we work on the range of motion, and just those different things to kind of help work the patient.
That's great. Lots of therapy services offered here. I know a lot of folks, they'll come in and they'll maybe come in for a stroke, and they come into the inpatient setting to the hospital, and then once they're discharged, they'll come out here to the therapy center to continue their care. Or even there's been, with COVID, the symptoms that it's caused from that. So what you guys do on a day-to-day basis is so important, so people can get back to their lives and get back to walking and living happy lives. So grateful for what you do, and happy OT month.
Conservative treatment options are typically where we start with both knee and hip arthritis. So if you come in to see us and your hip is beginning to be arthritic or your knee's beginning to be arthritic, there's sort of a stepwise approach that we take. Anti-inflammatories, which are medicines like Motrin, Advil, Aleve, are usually sort of first line. We have prescription forms of those medications that we can use. In our elderly population, that becomes a little more difficult because they have comorbidities, things like diabetes or stomach ulcers or disease, that they can't take those medications medications, even hypertension. So we'll try to treat them with medications if it's appropriate. When it's not, then we go on to things like injections. So cortisone injections, or there's these things called visco injections or visco supplements, which are lubricating type injections that we can use to treat knee arthritis as well as hip arthritis to try to control people's pain. And a lot of times we do that for years for people before they get to the point where those are no longer working and we're ready to talk about knee or hip replacement.
All right, boys, if you want to go to college, you have to clear out another one of these.
What if we told you there was a better way to save for your kids' college than pickle jars? Morris Bank's Savings Builder account and Moolah makes saving for your kids' college easier than ever. All you have to do is connect the account to your debit card, where it automatically rounds up your purchases to the nearest dollar, depositing that spare change into a Moolah account where it will grow into a nice little nest egg for whatever your kids have their sights set on.
All right, we're back here with two more of our OTs, and again, we're celebrating Occupational Therapy Month, OT Month, here at Fairview Park Hospital. And I have with me today
My name is Remy.
Remy. And how long have you been at Fairview Park?
I've been here for a year.
For a year. All right, and tell us a little about yourself. Where did you go to school?
Well, I go to school in the Philippines. I'm a graduate of Our Lady of Fatima University in the Philippines, and then I took the boards here, and I've been traveling occupational therapy, like from state to state, and then I ended up here.
We're so glad to have you here. All right, and I also have with me today Melinda. Melinda, tell us a little bit about yourself.
My name is Melinda, and I'm from Ohio State University, and I've been here at Fairview Park almost 2 years. I traveled for a number of years and have just been in different states working, and it is really the place to be. The patient care here is fabulous, and I love it here at Fairview Park.
Well, we're so grateful to have you here. And Melinda, tell me a little bit, how does the outpatient service vary between the hospital stay and the outpatient?
At the hospital, we work to get people home. So for occupational therapy, we work specifically to get people able to dress themselves and to bathe themselves and get them back to doing their daily routines. And we look at safety for going home, be sure they can walk back and forth to the bathroom and all their daily things. And then they go straight to the outpatient center. And for the outpatient center, for those who need that continued care, they work specifically on different impairments, sometimes multi-system impairments. People may have COPD or stroke or cardiac problems, and if they need continued care, then they go from the hospital to the outpatient service center.
Okay. And tell me a little bit, what's the difference between an OT and a PT?
For occupational therapy, we get folks back to doing their daily routines. In physical therapy, they work on balance and mobility, gait training, and getting your walking better, and maybe to be able to walk with a walker, then to a cane, then to independently. A lot of times folks get us confused, but that is the difference. OT works to get you back to your routines, and physical therapy gets you back to independent walking.
And Remy, can you tell us a little bit about the role of an OT in a hospital stay when it's a short stay in that environment? And then how much does then an OT spend per patient? What does the time look like?
Well, the role of occupational therapist in the Philippines is to assess the patient's deficits once they come in the hospital because they're sick. And so we would assess their skills, motor deficits, sensory deficits, and their deficits in performing their ADLs, which is bathing, dressing, feeding themselves, going to the bathroom. We also participate in discharge planning. We communicate with the staff, like the medical staff, the doctors, the nurses, the case managers, and we usually recommend on the discharge setting where the patient would be discharged when they're stable enough, whether it be at home or in outpatient setting or inpatient setting, or whether they would be recommended for an assisted living facility or a nursing home. And we usually spend about 10 minutes to 50 or probably an hour to an hour and a half of therapy with them to get them to be more independent when they go home and safely.
Great. It's really that one-on-one time that just makes the difference, and getting people back to being mobile. And so, again, well, thank y'all so much for everything you do, and happy OT month. And we'll be back with 2 more of our OTs.
Would you like to reduce your energy cost, boost your air conditioning efficiency, and reduce the chances of structural damage due to termites, rot, and mold? Call Dry Zone Crawl Space and Foundation Specialists today at 478-410-2847.
Thinking about what to do after high school? How about jumping directly into your future? Oconee Fall Line Technical College offers hundreds of programs to prepare students for the real world. From business to healthcare to professional and technical services, our graduates go straight into a career. And tuition, surprisingly affordable. At Oconee Fall Line Technical College, you will succeed sooner. Apply today at oftc.edu.
All right, we're back here with 2 more of our OTs. I know you've already met Terrance, but I also have with me today.
I'm Olivia. I've been at Fairview for 13 years, but my story's a little different. I started out as an occupational therapy assistant for 12 years and recently graduated as an OT through a bridge program at University of Louisiana at Monroe. And I'm glad to be back here as an OT.
Great, we're glad to have you. Louisiana, that's not too far away. We're glad we got you back here. Well, Olivia, will you tell us what are the different types of patients for occupational therapy in the hospital environment?
Okay, well, we have several. We kind of can start out if they're in critical care. So we start with them as soon as they come off the vent. And that's anywhere from just respiratory failure from COPD, strokes, trauma. And then we kind of follow them to the floor. Be just general weakness. We also take care of the joint patients. So if they've had back surgery, neck surgery, a bypass surgery, gastric bypass, knees, or now we're starting to get some shoulder surgeries. So we just kind of are all the patients can be seen by OT if they have any weaknesses or problems.
And Terrance, can you tell us about the different types of patients in the occupational therapy and the outpatient therapy environment?
Okay. So in the outpatient therapy environment, we service patients from all walks of life. So our pediatric patients may have conditions such as developmental delay or developmental disorder. Our adolescents to adults, we service them with shoulder issues. So they have a shoulder replacement, rotator cuff, any type of debilitating condition. And for our older adults, we do strokes, heart attacks, COVID recovery. So any type of condition that's debilitating, that takes a person out of their daily routines, we work with them to get them back into doing that and to regaining that independence.
That's great. And I know, in the past year, there's been a lot of changes. Can you maybe talk to me a little bit about what the changes have been and what safety precautions that are being taken with, being in the pandemic still?
All right. So over the past year with the pandemic, like she said, we've had a lot of changes. Some of those changes include all patients and staff are required to wear masks. Staff are required to wear masks and goggles. Each piece of equipment is cleaned before and after a patient uses it. And we also have guidelines to make sure that the number of people in the gym do not exceed a certain amount. So we have plenty of precautions in place to ensure that we work with our patients safely and keep them healthy.
And I know I've personally spoken to many patients that you guys have cared for that have, had COVID and they were on the vent and they were discharged and they came back here to learn how to, walk again and get their strength. And just hearing those stories and, what y'all have done to help them is just remarkable. So thank you for what you do every day. And I just think that, with everything going on the past year, you guys have really stepped up and made a big difference. So thank you. And so I wanted to make sure you're aware we also have an inpatient rehab, and that is inside the hospital, and that typically the rehab for that is if you come in and you need to stay in the hospital to regain care and strength, and that is located inside the hospital. And so today we're here with the Fairview Therapy Center with the outpatient rehab therapy. And so if you would like to come by and make an appointment, go on our website, fairviewparkhospital.com, and you can learn all about the services we offer. Thank you for joining us today, and be sure to thank OT on OT Therapy Month. Thank you.